Okay, good. So next one, hand behind your back again. Take the side of your head and you're going to pull your ear down to your shoulder. This. So you're going to take the other side of your head back here. Yeah, you're going to reach across and pull your ear down. So you'll feel it right in here. Good. Lawrence has been doing this at home, so he's really good at it.
How do you teach it?
5 breaths on that one as well. And then when you're done, you can switch and go ahead and do the other side.
The next one is
No. Okay, well we talked a little bit about the polar guarding earlier, what it does, how it strengthens your neck muscles, and then how it gets that curvature back.
so it's this little guy. So it's gonna like, a lot of us have forward neck curvature like this, and we need to restore the curve. So it goes behind your neck, it's stretchy, and you pull it forward, and you just do exercises like this, and side to side.
Yeah.
I'll get one.
Okay, so we'll skip that one for now, we'll come back to it when she has the polar guarding. Okay. The next 3 require us to be on the ground, so if you guys want to do it, we have some extra yoga mats. If you guys want to come follow along with us. No? Nobody? Okay. That's okay.
Take me 10 minutes to get up.
You're getting faster though. Okay, so I'll just walk you guys through it then real quick. So these next 3 are, this is for your lower back. This is to help your SI joint. Now your SI joint is the biggest joint in your body. It's what you use to walk. So we all use that one. It's really important to keep that loose and just ready to go. So to do that, you're going to lay flat on your back. A lot of people say they do these ones right when they get up in the morning before they get out of bed. So I'm sure they're going to be familiar to most of you guys. So to do it, you lay flat on your back like this, legs both extended. Pull one leg up to your chest. Hold that for 5 breaths like we talked about before. Then with the same leg, take it and go pull up to your opposite shoulder. So right knee goes to the left shoulder. Hold that for 5 breaths like that. You'll feel it all in here, and then you're going to be getting this joint back here.
And your feet are like this, not flopped over.
Yeah, they're going to be up like that. The next one is going to be taking that same knee and pulling it across your body like this. I'm actually not flexible, I can't even touch my toes. Okay, so then you're going to get that and hold it for 5 seconds too. You're going to feel that, or 5 breaths, I'm sorry. You're going to feel that all along your quad muscle right there.
And your hands the opposite way.
Yes.
Yeah.
Yeah, well that's just eyeballing that.
Yeah.
You can look straight ahead like that. Some people turn. The head's not so important. It's really about trying to push that knee down to the ground. And then do the same thing the other way. So those 3 stretches for both knees every morning. People do it, or before they go to bed. It would be really good. Let's see what's next in here. It does, yeah. And you'll feel it twisting back there as well as you go across.
Someone told me that you're supposed to go like this with your feet too.
Yeah, Noah has people do that. If you guys have met Noah,
Yeah.
he works on sales. He'll have people do that as well while they're getting treatment. He'll have them flex their foot like that, back and forth, go side to side like that. It's good to keep.
Before you get out of bed too.
Yeah. Oh yeah, definitely. Just to get it started. Okay. This one is a good one for you guys to all try as well. So it's a scaling stretch. It's called pin and stretch. So what you're gonna do is everyone sit up straight. You're in a classroom. Good. 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 All right. You're gonna feel underneath your collarbone for tight muscles in here. Once you find them, we're just gonna focus on one side for now, and then we'll switch over to the other. So you're gonna find it and then pin it, which means first pull your head down like this, your chin down to loosen up that muscle. Pin it like that, and then you're gonna stretch up into the other side. Once you push down on it, it keeps the muscle in place, and then as you're pulling it, you'll feel that stretch.
And it's under your collarbone?
It'll be under your collarbone, yeah, right over there. Yeah. When Noah talks about it, he says it feels like uncooked spaghetti. I don't feel uncooked spaghetti, but you guys might, so I like to tell you anyway. So it looks like that. And then you hold it up in that position for 5 breaths. Once you're done with that, you can switch into the other side.
So you're feeling for a pressure point?
Not so much a pressure point, you're feeling for tight muscles. So let's see. Yeah, so right about there. I would push down on that. So bring your chin down, press into it, and I'll pull up in the other way. Feel that stretch? Yeah. So that's what you're feeling for on both sides.
It's not more down under.
Not necessarily. Yeah. They could be up or down the collarbone right up in there. Yeah.
And what we're feeling for feels when uncooked spaghetti?
Noah says that. I've never felt uncooked spaghetti under my skin, so I don't know what he feels.
Oh really? I feel it.
You feel the uncooked spaghetti?
Yeah.
Okay, maybe I don't. Okay,
It's
but pull your chin down like this.
Stringy.
Not so much
Yeah.
feel it, but yeah.
Stringy.
It's the muscle. You feel something here. Yeah.
So-
You can feel it right about.
Right above the sun?
There's a muscle right there. So
Right there. So you might feel.
Right
Oh,
in
see,
there.
like right
You
there?
can take both hands,
Feel that?
go like this. And then
With this now.
okay.
Yeah.
It's kind of feels like
One on top of
tendons.
the other.
Yeah,
So
yeah.
So you want to push
I
down.
can feel it.
Yeah, so put
And
your
then you
neck this
pull
way
up
towards
and-
it.
Okay.
Pull
And then-
up and away. There you go.
Up and away.
Do you feel a
This-
stretch in there?
this way, so
Definitely
we
feel a
back.
Good. Yeah, so then you hold that for 5 reps.
Yeah, you feel
And then
it.
you're
Yeah.
switching to the
Feel
other
that
side.
muscle where you put your head down?
So it's gonna go like
The
this.
muscles
If you're
pulse?
feeling from this side, you're gonna pull your chin
Oh, you just
up
feel
to
the
the
muscle
other
pulse. So
side.
feel right there, like
Yeah.
that little kind of string sort of.
Okay, got it.
Yeah,
Wanna
so
come
then
down a
push
little bit
down,
more,
so
let's see.
bring your head towards it, push down.
Bring your chin over
and then you
towards
go
here.
up
Bring it
and
down now. Okay, see
So
that's
as
gonna loosen
far
up
as
the
you can
muscles. Now you can feel on
Good.
here.
Yeah, and
Right
you can
there.
keep
Now
finding
up
the
and
spots
away.
all along.
That way. Now up.
So I
There you
feel
go.
some
You feel a
there,
stretch.
and then I keep
Yeah, so
over,
that's
feel
what
more
you're
this
feeling.
way. And you want to go directly towards.
Yeah, that's a good one.
Yeah.
These are for
Yeah.
your scalene muscles in here.
Mhm.
You mentioned that 5 reps, right? Just for one.
Yeah, just once. Yeah, if there's one side tighter than the other, I would say start on that side, do the other side, and then go back. Okay, so you get that side twice.
A lot of the exercises, I do like 3 times of them, but you don't really need to do 3.
Some of them we have that they'll do three different times, like so many repetitions, 3 different sets. But on this one, it's good to leave just do it once. Yeah, you can definitely do it more, but
What is the benefit of this?
this is going to loosen up all of these muscles in here. So a lot of us are really tight in here, and if you look at your X-rays and you see sometimes some people are leaning more to one side or the other. This is going to help loosen up the muscles to help you push it back to that direction. So a straight spine is just straight up and down, right? But some of us are leaning over to the left or the right a little bit. We do an exercise, we'll put a block up against the wall and you'll be pushing your head. I'm so bad at it, but you try to push your neck over like that, and that's gonna help push your spine back into place to get it going upright again. So this is gonna help loosen up the muscles and just kind of prepare it for that exercise.
And one thing that's a good note is like when we do the home care for our patients, it's really specific because we know what their postural distortions are. You know, we know if they're going to the right or to the left or what. But all these are really general and good. But if you get the X-rays, then you know which side do I need to be stretching and which side do I need to be strengthening. All that kind of stuff.
Yeah, exactly.
Lately, just lately, my neck has been popping. I get this, I guess it's because I'm looking at,
Mm-hmm.
and it's getting stiff and it pops. Oh
Pops.
heavens, and my hip pops, my knees pop, everything pops.
These
Just your
stretches.
neck, you're lucky.
Fine. Neck pops.
No, so if it does pop though, it would be really good to do those stretches.
It hurts.
It hurts.
Yeah, so then I get it back in place and so sort of.
I got that.
But
Back
that's
on the
lately,
computer.
it's just lately.
Just lately. The puller dog would be good because it would strengthen the muscles in the back too. If it's in the back, it could be a
I
lot.
think it's that
Yeah.
Yeah,
I know.
I'm really
Text neck, girl.
Texting neck. That's a real thing.
It is.
Now.
Mhm.
Yeah.
It is.
This will help texting neck.
Yeah.
Show them the
Okay,
program.
we'll go back to the puller dog. So
I can do this one.
you guys, if you've had your home care date, you've seen this one. We give this to everybody. So you put it around your neck like this. Depending on the curvature of your spine, if you're too far forward,